First of all, does everybody know what essential intrapartum newborn care is? Let's discuss it right now.
You should
1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Baby's out.
The Essential Intrapartum and Newborn Care is a policy that incorporates evidence-based procedures for the recommended care of newborns and during the postpartum period. These cares include immediate or thorough drying, skin-to-skin contact between mother and the baby, delayed cord clamping, and early initiation of breastfeeding. These are the skills that the nurse must practice and master. Why hand washing is essential? Hand washing is one of the simplest yet most effective ways to maintain personal hygiene and prevent the spread of diseases. As a universal practice emphasized in healthcare, schools, and homes, it plays a vital role in protecting individuals and communities for illness caused by the harmful microorganisms. So for the open gloving, after a hand washing procedure, open gloving must be done using a sterile glove that is appropriate to the size of your hand. For the immediate drying, using a clean and dry cloth, immediately dry the whole body in order for the baby to not experience hypothermia.
okay.
Skin contact. If the baby is crying and breathing normally, immediately place the baby in a front position on the mother's abdomen. Delayed proper cord clamping and cutting clamp the umbilical cord of the baby after the pulsation has stopped. It is usually between 1 to 3 minutes. Put clamps tightly around the cord at 2 cm and 5 cm from the newborn's abdomen. Then cut using umbilical cord scissors. After cutting the umbilical cord of the baby, observe for oozing blood and always make sure not to make a mistake umbilical cord milking towards the newborn. After the cord clamping procedure, make sure to give the mother a 10 IU units of oxytocin intramuscularly. Giving oxytocin after birth helps the mother to prevent excessive bleeding and for the breastfeeding.
The next step is to get the anthropometric measurement of the baby, including the body weight, which is probably 2.5 kilo to 4 kilos. It's normal. Measure also the head, chest, abdomen, and the birth length of the centimeter using the tape measure. Interlock your fingers together to clean the spaces between your finger, base of thumb, back of fingernails, wrist. Rinse your hand with water, then dry it clean with a paper towel or tissue paper. Face your right palm over the left dorsum. It's where the back of the hands. Then, the left palm over the right dorsum, rub them properly.
Hindi ka nalalagyan ng cotton yan.
Pwede naman nilagyan.
Di ba?
Hindi.
Di ba nilalagyan nila ng cotton?
Outer canthus to inner canthus.
Inner to
Inner to outer. Inner to outer.
sa taas. Pwede ba sa taas? Alam ko dito sa ano.
This first step is that when you put the diaper on the baby, make sure that the diaper is below the stump in order to prevent the poop, then the pee to reach the stump. Parang hindi kailangan ng swati.
Ipasok mo lang sa upon. Huwag ganyan. Ipasok mo lang sa yan. Ganyan.
First, make sure the newborn's neck is neither flexed nor twisted. Make sure the newborn's is facing the breast with the newborn's nose opposite her nipple and chin touching the breast. As a nurse, you must always check and observe the condition of the baby. Only when the newborn shows feeding cues. Example, opening of the mouth, thonging, licking, ruthing. Make a verbal suggestion to the mother to encourage her newborn to move towards the breast. Example is nudging. Help or guide the mother when it comes to proper positioning of both the baby and the mother during breastfeeding. These are the most important advice you can give to the mother.
The next action you must make is to make sure that the mother and the baby is not separated and must initiate breastfeeding to provide the baby the nutrients that comes from his or her mother's milk.
As a nurse, you must always check and observe the condition of the baby. Only when the newborn shows feeding cues. Example, opening of the mouth, thonging, licking, ruthing. Make a verbal suggestion to the mother. As a nurse, you must always check and observe the condition of the baby. Only when the newborn shows feeding cues. Example, opening of the mouth, thonging, licking, ruthing. Make a verbal suggestion to the mother to encourage her newborn to move towards the breast. Example is nudging. Help or guide the mother when it comes to proper positioning of both the baby and the mother during breastfeeding. These are the most important advice you can give to the mother. Furthermore, teach the mother to treat local umbilical infections such as applying topical antibiotics, antibacterial ointment, and making sure that the cold is okay lang dyan.